Welcome to episode 51 of the Pulse of Physiology. I'm your host, Dr. Jim Davis, and today we're talking about the mechanisms of pulmonary ventilation. These are the processes that allow us to move air into and out of our lungs. By the end of this episode, you'll understand how Boyle's law applies to breathing, how factors like compliance and airway resistance influence ventilation, and how surface tension and surfactant help prevent lung collapse. So let's get started. The foundation of ventilation is Boyle's law, which states that as pressure goes up, volume goes down, or vice versa. So in other words, this means that pressure and volume have an inverse relationship. As volume increases, pressure decreases, and vice versa. During inspiration, the thoracic cavity expands. This increases the volume of the lungs. This expansion causes intra-alveolar pressure to drop below atmospheric pressure, which pulls air into the lungs. During expiration, the thoracic cavity contracts, which decreases lung volume. This raises intra-alveolar pressure above atmospheric pressure, pushing air out of the lungs. Inhalation starts when the diaphragm contracts and moves downward. This increases thoracic volume. The rib cage also expands outward, further increasing space within the chest cavity. As the volume increases, intrapleural pressure becomes more negative, which pulls the lungs outward. This creates a pressure gradient that allows air to flow into the lungs. Inhalation continues until intra-alveolar pressure equals atmospheric pressure, at which point airflow stops. Expiration is primarily passive during quiet breathing. The diaphragm relaxes, the ribcage recoils inward, and thoracic volume decreases. This causes intrapleural pressure to become less negative, which reduces the outward pull on the lungs. As lung volume decreases, intra-alveolar pressure rises above atmospheric pressure, which pushes air out. Expiration continues until intra-alveolar pressure equals atmospheric pressure and airflow ceases. Now, ventilation can be affected by multiple factors, including airway resistance, lung compliance, and surface tension in the alveoli. Bronchoconstriction decreases airway diameter, which increases airway resistance, making both inspiration and expiration more difficult. Bronchodilation increases airway diameter, which lowers resistance and makes breathing easier. Compliance refers to how easily the lung expands. High compliance means the lungs expand easily, which aids inspiration, but possibly reduces the efficiency of expiration. Low compliance means the lungs are stiff and difficult to expand, requiring more work to breathe in. Generally speaking, the lungs are not very compliant, but different lung volumes have different compliances. Now, elastic recoil helps the lungs return to their resting size after inspiration, which aids in expiration. Diseases like emphysema reduce recoil, making it harder to exhale. Alveoli are lined with a thin layer of fluid to support gas exchange. This fluid creates surface tension, which can cause alveoli to collapse. Surface tension is just the amount of work necessary to increase surface area. So if you've got a thin layer of liquid on the surface of these alveoli, in order to spread that liquid out, it requires work. Now, pulmonary surfactant, which is produced by type 2 alveolar cells, reduces surface tension, making it easier to inflate the lungs. Without surfactant, the work of breathing would significantly increase, especially in small alveoli. Finally, you have the rib cage and the lungs. There are two forces that oppose each other that constantly act on the lungs. The rib cage tends to expand outward, and when it does so, it pulls the lungs open with it. However, the natural tendency of the lungs is to recoil inward because they have an elastic nature made up of elastic fibers, as well as the surface tension we discussed earlier. The balance between these forces combined with negative intrapleural pressure helps keep the lungs expanded between breaths. So we have four key takeaways we want to summarize. First, Boyle's law explains how pressure and volume changes drive airflow into and out of the lungs. Inspiration requires an active increase in thoracic volume, while expiration is normally passive due to the elastic recoil. Factors like airway resistance, compliance, and surface tension affect how easily the lungs change volume. And surfactant reduces surface tension, which helps prevent alveolar collapse. And so that's it for episode 51 of the Pulse of Physiology. I hope this episode has clarified the mechanisms of pulmonary ventilation and how multiple factors contribute to efficient breathing. Join me next time for episode 52, where we'll explore pulmonary volumes and capacities, which will give you a better understanding of how we measure lung function. Until then, keep questioning, keep exploring, and stay curious.